We want to thank our sponsors again for helping sponsor the Move Utah Summit 2022 and appreciate their support. And then we are grateful for our speaker, our first breakout speaker for the Good Health Track today, Dr. Liz Joy. Dr. Joy is a Senior Medical Director for Wellness and Nutrition at Intermountain Healthcare in Salt Lake City, Utah. Dr. Joy practices family medicine and sports medicine at the Salt Lake Live Well Center. She is also the past president of the American College of Sports Medicine and the Female Athlete Triad Coalition. So we are grateful for Dr. Joy today and for her time. And so I will turn it over to Dr. Joy and she will share her presentation.
Well, thanks so much, Alicia. And it's a real pleasure to be here and join all of you today for the Move Utah Summit. Can you guys see my screen?
Yes.
Excellent. All right. Well, without further ado, I don't have any conflicts of interest today. And I thought we would start with a little audience participation. So we are going to play Move Utah Jeopardy. And I have identified some friends who are going to play the game with me today. But I would ask all of you, and I'm going to try and keep an eye on the chat here, to play along with us and to respond in the chat if you know the answer to the Move Utah Jeopardy question. So here we go. First question is around obesity. And let's see, I would ask who wants to take the obesity question? Oh, I can see a hand up.
Angelo, go ahead, Angelo.
Alicia, it looks like everybody is muted.
All right, Angela, can you not get off mute? Let's see.
Okay.
Oh, there you go.
I think I'm unmuted now, right?
Yes.
Okay, cool. Thanks. I want to play, Alex, Obesity for 200. It's like a dream come true of me, Liz, to play live Jeopardy. So.
I know, Jeopardy on Zoom, it's like a whole new concept. Okay, so you're taking Obesity for 200, is that correct?
That is correct.
All right. So this health behavior decreases mortality regardless of body weight. And remember, if you're playing Jeopardy, you have to answer in the form of a question.
What is exercise?
You are correct. The answer is, what is physical activity? So we'll give you that one. And I thought I would share just a few studies that would absolutely support that. So this one that was published about a decade ago that looked at the effect of both body weight and physical activity on life expectancy. And the dark purple bars are people who are meeting the physical activity guidelines for Americans recommendations. The medium purple bars are those who meet the guidelines about halfway. And the light purple or lavender bars are those who we would define as inactive. And what I want you to notice, as you are looking from the left to the right-hand side of this graph, is that regardless of body weight, you can see that physical activity is incredibly protective against years of life loss. All right, let's go to the next slide here. This is actually the results of a paper that was published in 2021, looking at weight loss versus fitness and physical activity for reducing health risk. And in the blue bars, you see people who are defined as unfit. And the red bars are those who are considered fit. And whether you look at all causes of mortality, or you look specifically at cardiovascular disease mortality. And again, looking at the various weight categories of normal weight, overweight, and obese, you can see that fitness is protective against both all-cause mortality and cardiovascular disease mortality. So, oftentimes we hear this debate, is it fitness that it protects health, or is it decreasing fatness? And I would say that it's really no longer a debate, that you can be, healthy at every size, and that fitness matters more than fatness. All right, so we have our next question coming up, and I believe we're going to hear from Jared. Jared, would you like to take a question for us?
Yes, I'd love to take a question. Let's do cognitive decline for 300.
All
Angela
right.
went 200, but I'm going to one up him and go for 300.
Yeah, go big or go home, Jared. I like it. All right, so you're taking cognitive decline for 300. So this evidence-based treatment can reduce the progression of cognitive decline.
What is walking?
What is walking? Well, you are on the right track. It's definitely, there's definitely a relationship between physical activity and cognitive impairment, and specifically the progression of cognitive impairment to dementia. This is a study that was published a couple of years ago, looking at the incidence or the likelihood of developing an Alzheimer's type dementia. And what I put in the red squares there are the hazard ratios, or excuse me, the incidence of developing dementia. And you can see that people who have maintained physical activity throughout their lifespan, and this is a huge sample size, there's almost 57,000 people, compared to those who have never participated in regular physical activity, nearly 100,000 people. And you can see that those who have never participated in regular physical activity are nearly twice as likely to progress from mild cognitive impairment to dementia. And in yet another study that actually looked at cardiorespiratory fitness, which is oftentimes, which is a result of regular physical activity. And if we look at the graph in the upper left-hand side, we can see that, as cardiorespiratory fitness decreases over time, the likelihood of dementia and dementia-related death increases. And conversely, if cardiorespiratory fitness actually improves over time, we see a decrease in the likelihood of dementia and dementia-related mortality. And it was actually the conclusion of the authors of this study that was actually published in the Lancet that cardiorespiratory fitness is an independent risk factor for incident dementia and dementia mortality. And, I often hear that, patients feel like, avoiding diabetes or avoiding a stroke or heart disease, is something that is under their control, that if they engage in a healthier lifestyle, they can probably avoid contracting some of those conditions. But they kind of feel like dementia, losing your cognitive abilities, your ability to speak and to walk and to know your loved ones, that is seemingly out of their control, but it isn't true. And if there's one thing you really take away, from my presentation today is, what's good for the heart is good for the brain, and vice versa. All right, so moving on with our Move Utah Jeopardy. Let's see, I think Jim is going to ask a question about COVID-19.
Hi, Liz. I'll take, COVID-19 for 200, please.
COVID-19 for 200 it is. All right, so this health behavior is associated with decreased mortality from SARS-CoV-2.
It has to be. What is regular exercise?
Jim, you are right on. That is exactly the answer. So this was a study that was done by a close friend and colleague of mine at Kaiser Permanente, Dr. Bob Salas. And he looked at the relationship between physical activity, self-reported physical activity, and COVID-19 outcomes. And you can see that this was, again, a large study, nearly 50,000 adult patients. And what they found is that the patients who had COVID-19, who were consistently inactive during the 2 years preceding the pandemic, were more likely to be hospitalized, admitted to the intensive care unit, and die, compared to patients who were consistently meeting physical activity guidelines. And they found that other than advanced age and a history of organ transplantation, physical inactivity was the strongest risk factor for severe COVID-19 outcomes. Now, we've known for a long time that physical activity can be protective against chronic conditions like diabetes and heart disease and some cancers. But this is one of the first studies that actually showed us that physical activity can be protective against an acute infectious disease, such as that caused by the SARS-CoV-2 virus. And this is yet another study. This came out of the Mayo Clinic. And rather than looking at self-reported physical activity, this actually looked at measured cardiorespiratory fitness. And they looked at just under 250 people who had undergone a clinically indicated cardiac stress test between January of 2016 and when the pandemic really ramped up in the United States in March of 2020. And all these people tested positive for COVID-19 sometime between March of 2020 and June of 2020. And what they found was similar to what we observed in those reporting higher levels of physical activity, lower levels of physical activity. Those with lower cardiorespiratory fitness, it was strongly associated with a higher risk of hospitalization. So again, showing that not only is physical activity, but the resultant fitness actually is protective against SARS-CoV-2. All right, moving on with Move Utah Jeopardy. The next question is going to be around diabetes prevention. And Clint, what would you like to take here?
I would like to take diabetes for 100, please.
Diabetes for 100. Okay, here you go. So this health behavior can decrease the risk of type 2 diabetes. This is kind of a gimme, Clint.
Yeah, I think I got this one. What is physical activity?
Right, you are. Right, you are. So I'm going to share one of my favorite studies here. This comes from our friends in Finland. It's called the Finnish Diabetes Prevention Study, and it continues to this day. And they have been pumping out articles for more than 20 years, looking at the relationship between lifestyle and the likelihood of developing type 2 diabetes. And let me kind of explain the graph on the lower left-hand side. It's looking at the relative risk of developing type 2 diabetes and walking for exercise and hours per week. And the tallest bars are the people who walked for less than 1 hour per week. The middle bars are those who walked between 1 and 2.4 hours a week. And the smallest bars are those who walked for 2.5 hours a week or greater. And they did all sorts of statistical manipulation on the data. And you can see that walking for exercise is incredibly powerful, as it really didn't change the model, and it was highly statistically significant. So despite all these adjustments that they did, they found that individuals who engaged in about 2.5 hours per week of walking during follow-up were nearly 70% less likely to develop diabetes than those who walked less than 1 hour per week. So who would have guessed, that walking for 30 minutes a day, at a moderate pace would decrease your likelihood of developing type 2 diabetes by nearly 70%. Really impressive. All right, we are moving to the end of Move Well Jeopardy. We're on our last question here. And Alicia, what would you like to take for mental health?
Going big, mental health for 300, please.
Way to go, girl. All right, mental health for 300. Here we go. This health behavior is associated with a lower risk of depression.
What is physical activity?
And you are so right. All right. Okay. So this is a really interesting paper that was published a few years ago. And the reason why I picked it, and there were, probably 100 that I could have chosen. But I like this one because it looked at different age groups. And so let's start in the upper right-hand corner, looking at depression risk amongst young adults. And again, comparing those who report 0 minutes of leisure time physical activity per week. The next group are those who report 1 to 74 minutes, 75 to 149, and then those who are achieving 150 minutes or more per week of moderate to vigorous physical activity. The dotted lines are males and the solid lines are females. And although you can see that in general, females have a higher frequency of depression compared to males, but we do see a very consistent relationship that as physical activity levels increase, the percentage of those who are affected by depression decreases. And the authors concluded that at all levels, for all ages of adults and for both genders, physical activity is protective against depression. And certainly, depression and anxiety have increased significantly during the pandemic as people are isolated. And this is something that many people have said has really helped them a great deal, is being able to get outside and do some physical activity to try and improve their mood during the course of the COVID-19 pandemic. All right, and then I just couldn't help myself. I just want to give you one more study to drive home the point even further. No jeopardy with this one, but this is a paper that looked at all-cause mortality. You can see on the y-axis, and across the bottom are daily hours of sitting, all right? And then within each grouping around daily hours of sitting, we have a decrease in physical activity per week. And so if I put a little circle around this triangle with the confidence interval bars, what it's showing us is that the combination of no physical activity and lots of sitting is pretty deadly. So, even if you have a role, that requires you to be, sitting at a desk, all day long, really encourage you to pay attention. If you've got that Apple Watch that's, that's buzzing on your wrist, that you get up and move throughout the day, because it turns out even 2 to 4 minutes of walking around can improve your health. All right, well, it's taken me about 20 minutes now, and we're finally going to get to some of the objectives of my presentation. It's really a pleasure to be here today for the Move Utah Summit. I'm a big fan of active transportation. And one of my areas of focus when I was many years ago, when I was doing my master's in public health, was really looking at the relationship between the environment and physical activity. And it's one of the reasons why I've been so involved in air quality and health and involved with my colleagues at the Utah Clean Air Partnership. But I thought I'd share just a few personal stories with you before I kind of keep going here. And I'm sure this is a statistic that is well known to many of you, that back in 1969, nearly 50% of children in the United States, and nearly 90% of those lived within a mile of school, they walked or bicycled to school. But today, that number has plummeted to less than 15%. So here's a picture of my commute to school when I was growing up in St. Paul, Minnesota. So my house in green, my high school in red, and it was about 1.5 miles from my house to school. And I would, some combination of running and walking, because it's pretty darn cold in Minnesota, and how much time I gave myself in the morning, I would make it from home to school. But I thought, I know everybody walks uphill both ways to school in lots and lots of snow, but truth be told, My mom wouldn't give us a ride to school unless it was colder than -10. And I can remember by the time I was 12, I understood the concept of wind chill. And I tried to use that to my advantage, but it didn't always work. But yes, I walked 1.5 miles from my house to my high school every day, unless it was colder than -10, and then I got a ride. But I really come by my desire to move my body and to walk pretty honestly. And the picture on the upper left is my great aunt, Lilius Joy. She lived an incredible life. She died when she was 96 years old, ironically in a car accident, because she never learned to drive because she walked everywhere. And what you're seeing in the map in the middle, her house is in green, and the VA hospital, which at the time was at Fort Snelling, is in red. And it was a 4.5-mile walk from her house to the VA hospital. And she was a consummate educator, had a college degree in math. But at this point, I think in her life, she had by and large retired from teaching high school. And she used to go to the VA hospital and read to veterans who were hospitalized there, who had sustained injuries to their eyes and blast injuries to their eyes and couldn't see. And so, by the time I rolled around, she was 80 when I was born, and she would walk from her house to our house for Sunday dinners. And we would meet her at the corner store. She would give us a nickel to buy candy. And then we would walk the 4 blocks to our house. And the reason I have a picture of the sidewalk there is that Auntie used to tell me that she would only allow herself to take 2 steps per square of the sidewalk, because that forced her to walk faster. And because she didn't drive and she walked everywhere, that she didn't want to be too slow, and it would take too long if she walked too slow. And I'm telling you, this gal was so ahead of her time, because in 2011, there was this paper published in the British Medical Journal that was entitled, "How Fast Does the Grim Reaper Walk?" And it was really looking at the relationship between walking speed and risk of mortality. And what they determined was that you have to walk 3 miles per hour in order to stay ahead of the Grim Reaper. And I think, my great aunt, affectionately known as Auntie, was probably pretty successful with that. All right, well, let me just kind of lay out a few more objectives for the rest of my presentation today. And these are the 4 Ps: public health, policy, partnerships, and people. And in regard to public health, I'm going to present some public health data regarding physical activity and health outcomes. We'll talk a little bit about policies that have been created and implemented to promote regular physical activities, describe some key partnerships that are driving necessary change to support active living for all people. And then I'll finish up and talk about what can people do to achieve and sustain regular physical activity to improve their health and well-being. All right, well, let's start with public health. I think this is kind of a compelling why. And this is looking on the left-hand side, the percentage of US adults aged 18 and older who meet both aerobic and muscle strength guidelines between 2008 and 2016. And men perform somewhat better than women, but it is a significant minority of the population. Only 26% of men and 19% of women are meeting both aerobic and muscle strength guidelines. And the figure on the right is the percentage of US high school students who meet aerobic physical activity and muscle strengthening guidelines. And again, we see that boys are performing somewhat better than girls, but on average, 80% are not meeting those guidelines. And so let me just take a pause for a moment and tell you what those guidelines are. So the physical activity guidelines for Americans would recommend that adults achieve 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity, and perform muscle strength training of major muscle groups at least twice a week. And for high school students, that they are achieving essentially the same, about 150 minutes of moderate to vigorous physical activity. So I suspect some of you are familiar with the youth risk behavior study, which comes out, I think, every other year. It's affectionately known as YERBUS. And we have the most recent data we have is from 2019. And in this slide, I'm comparing Utah to the United States. And I know the print is a little bit small, so I'm just going to call out a few areas. So one is looking at the percentage who were not physically active on 60 minutes on 5 days of the week. And for Utah high school students, that's about 50%. 80% were not physically active on 60 minutes on 7 days of the week, which is really the recommendation for the physical activity guidelines for Americans. And 51% did not attend physical education class on 1 or more days, and 86% did not attend physical education class on all 5 days. Now, I mean, I suspect many of you in the audience today are parents, and you know, where do your kids spend most of their waking hours? You know, it's in school, and yet, you know, I think we you know, have had some policies that have not really supported the inclusion of physical education as part of just traditional education in schools. And when one of our former administrations passed the No Child Left Behind legislation, you know, many of us who are kind of in the lifestyle medicine, physical education, physical activity space, you know, we really wanted to rename it, you know, No Child with a Big Behind, because, you know, what happened with No Child Left Behind is that a lot of funding for physical education, physical educators in schools, and the time allotted for physical education declined. And ironically, you know, what we're finding now is that kids really need that outlet, regardless of their age. That they learn better when they are moving more. And there's been some great studies out of California showing that, you know, kids who are most active and who are fitter perform better on standardized testing at all age levels and at all socioeconomic levels if they are the more physically active they are. And if any of you are interested in learning even more about that, you might read the book Spark by Dr. John Rady, who is a child psychiatrist out of Harvard. Really fascinating book that looks again at the relationship between physical activity and health outcomes, and particularly the relationship between physical activity and attention deficit disorder. And it's worth noting that, you know, our per capita use of stimulant medication for attention deficit disorder is one of the highest in the nation. All right, so I'm going to get off that soapbox, continue along with some of the public health data. And this is looking at physical activity levels during the pandemic. And again, I don't think it's going to come as any surprise to people that certainly initially we saw a significant decline in physical activity levels during the pandemic. You know, we were, you know, incredibly fearful about, you know, any interaction with anyone. And in terms of both steps and reported physical activity during the pandemic is in red, and in blue is the year prior. And this is actually some data that I believe comes out of from Fitbit, if I recall correctly. And overall, we saw more than a 40% decrease in moderate and vigorous intensity physical activity early on in the pandemic. And that is slowly but surely coming back to baseline. We're thrilled to see that. But you know, a lot of gyms closed and recreation centers closed, a lot of sporting activities stopped, and we still haven't seen a complete recovery in the fitness industry since the pandemic, with a lot of people just deciding to make different choices around their physical activity rather than being in a gym. Hopefully these people are pursuing some alternative activities. I'll talk a little bit more about that. But we did see a very significant decline during the pandemic. I want to talk a little bit about kind of some observed disparities that we see in physical activity. And the first I'm going to talk about is a report that came from the Utah Women in Leadership Project led by Dr. Susan Madsen. And this was published back in August of the past year, and looking at Utah girls and young women and physical activity, and looking specifically at physical activity by sex in high school students over like the past 11 years. And I think we were all incredibly struck. I think this actually made the front cover of the Salt Lake Tribune, that females are meeting recommended levels of physical activity at half the rate of males, and certainly that is highly predictive of how active they're going to be as adults, and it's just kind of a cycle that tends to perpetuate itself. That, particularly mothers are incredibly influential, when it comes to the physical activity of their children, in terms of modeling that, right. We model so many things for our kids. We model putting our seatbelts on. We model, not using tobacco products. We model, healthy eating, by sitting down and enjoying a family meal. There's so many things that we model that we take for granted. And, moving your body and walking to a neighbor's house for dinner, or walking to a corner store, or walking to get a cup of coffee, versus getting in your car and driving 3 blocks. Walking is good for your body, good for your, and as well as being good for the environment. We also observe disparities in physical activity by race and ethnicity. And this is a picture that comes from our IBIS public health database. And again, you can see that there are some disparities between the percentage of people who are achieving recommended levels of aerobic physical activity here in Utah. And likewise, we see disparities in people achieving recommended levels of aerobic physical activity by geography. And I just thought I would point out a few areas of the state who are both highest and lowest. If we look at the state overall, and this is based on a survey that is administered, a public health survey called BRFIS, or the Behavioral Risk Factor Surveillance System. And so this is self-reported, not measured. And so nearly 55% of adults say that they're meeting recommended levels of aerobic physical activity for the entire state. But if we actually look at it comparing the highest to the lowest, we see that, Park City has, more than double the percentage, or nearly double the percentage, of people who are achieving recommended levels of physical activity compared to people who live in the Glendale neighborhood of Salt Lake City. Let's move on. I'm going to talk about a few policies that I thought would be interesting for you to know about. So probably some of you knew that we do have physical activity guidelines for Americans. I've referenced them a few times. The first guidelines came out in 2008. And yes, and I did say the very first guidelines. I think we've had nutrition guidelines since the late 19th century, but our first physical activity guidelines didn't come out until 2008. And those were updated with the second edition in 2018. And in support of the physical activity guidelines for the Americans, we have the National Physical Activity Plan, which has been updated fairly regularly. And I serve on the board for the National Physical Activity Plan, as well as chairing the healthcare sector for the Physical Activity Plan, which guides healthcare